Right in the center. You know, like I think blue is my values, and then green and gold. How you got right out? Yeah, exactly. Yeah. There are a lot of those things. Capital on there. Like I want to show you. In the big money. Yeah.
All right. Welcome everybody to our next presentation. Jerry was going to do the intro, so hi, I'm Jerry. Just kidding. So we're joined here today by Mara Schradel. Mara is the Food for All Programs Manager at Land to Hand, based in Columbia Falls, Montana. Before joining Land to Hand in 2021, Mara worked in a variety of education roles, from teaching art to farm to school to communication behavior. Both in education and food access work, Mara believes a healthy community is one in which everyone has access to the resources that allow them to thrive. When not at work, Mara spends as much time as possible outside. She loves to hike, boat, bike, ski, and eat snacks on top of the mountain. So please help me welcome Mara.
Okay. We were just laughing about how I hate holding microphones, so we're just gonna walk through it, and maybe in a couple minutes it'll feel more comfortable. So we're gonna hope for that. I encourage anyone to come closer if they want. We're all very spread out. I'm hoping this is discussion based. I want to hear everyone's opinions, ask questions as we go. The slides are just going to direct how I talk about our program, but I mostly want to talk about what you all want to hear about. So please feel free to interrupt me. I'm also maybe just gonna wait a second while people filter in. Maybe they're on. This is great. Okay, so my name is Mara. I like to think of myself as ag adjacent. I have not worked on a farm. I didn't grow up on a farm. My mom was the extension agent that taught the master gardener classes in Oregon. So I feel like I have a little bit of that information, but not a farmer, mostly an educator. And I am representing our lovely crew here. We have 4 or 5 of us, including myself. So we are Land to Hand, Montana. We are in the Flathead Valley, Whitefish, and Columbia Falls. I live in Columbia Falls. We serve both Flathead and Lincoln County, actually. Our mission is to build a strong community food system that fosters socially just ways of accessing food. We have a lot of programs, and I'll go over many of them, but our 2 pillars are access and education. So we want folks to be able to get the food they deserve and know where it comes from. Maybe I'll do a little intro. Gretchen, you want to stand up? Wave your hand. Gretchen is our executive director, fearless leader. Whitney Pratt is our education manager. Caroline Peters is our educator. Emily Hess is our program coordinator. She technically works for 2 different nonprofits. Backpack. I'm not gonna say this. Backpack Assistance Program is based out of Whitefish. She's half-time with them and then half-time with our weekend backpack program. We like to claim her as full-time because her job is enormous. But our education program, we serve the Columbia Falls School District. We have summer camps that are open to the public 10 weeks-ish out of the summer. In the school district, we have a garden space, half acre. It has an MSU orchard on it that has a bunch of different pear and apple trees, which is exciting. We do a lot of community events in that space. If you're ever in the Flathead, please come check it out. It's beautiful. And we also have a building there that hopefully will have even more space for our classrooms soon. These 2 ladies do 2nd grade curriculum all winter long. So they do garden classes in the spring and fall, and then a lot of cooking and learning where your food comes from all winter. What else do we do? We have a big event. Free the Seas is coming up March 1st. We have posters out and about. Please come ask. No, they're good to start, but they will be out and about. Please come ask us about it because it's super fun. Coming up really soon. It is a big community push. It's been community driven for the last 10 years. This is our 10th anniversary. Land to Hand has started to organize it for 4-ish years now, but it's definitely a community driven event. And we'd love to share it with you. Emily's job is more on the food access side. So she does the backpack program is weekend food for kids in the school district that would otherwise rely on free and reduced lunch and breakfast. So we send home like a Ziploc bag full of shelf-stable food, and it supplements those meals that they would otherwise miss. We serve 350-ish kids a week in that school district, and then she serves Whitefish, Trigo only, Head Start, West Glacier. We're kind of all over the valley. We have started partnering sort of with the Flathead Food Bank to make sure that we aren't missing any of the really small or rural schools. And we just opened, we just moved into a really big new space, which is really exciting for us. And I think potentially will grow to more of a choice model. We try and have kid appropriate food in those bags, but I'm sure there's someone out there that has a whole stack of cans of tuna in their cupboard they don't want anymore. So we're hoping to add more choice into that program. Another piece of that is that we do the Fresh Snack Friday program in the Columbia Falls School District. So every week, every elementary age kiddo gets the opportunity to grab a locally produced carrot. In the fall, it's either pears, apples, plums, and then over the winter it turns into carrots. I wish we had the actual number, but hundreds and hundreds of pounds of carrots are in our walk-in that we then distribute. And we actually, I think, just finished. So we made it through to February this year. 4,000 pounds. Yeah, pretty exciting. Yeah. And then I also, alongside FoodRx, I run the farmers market programming in the summer. So we are the Northwest spoke for the Double Snap Dollars network. So I help Lincoln County farmers markets and Flathead County farmers markets operate those programs. We do a senior coupon program. This last year, we were part of the senior farmers market nutrition program, which unfortunately lost federal funding. So we will do an in-house senior coupon program. What else do we do there? We have fun little education pieces of the farmers market. We try and get kids to come grab a school coin from us. So it's a $5 coin. They get one a summer, and they can spend it on any fruit and vegetable that they want. We also have a little scavenger hunt for them to get to know their farmers at the market, which is pretty fun. Honestly, my favorite part of the farmers market. We make them draw their favorite vegetable and they get some basic drawings. That is a lot of what we do. And then what I'm here to talk about today is FoodRx. This has been a big part of my job for the last 3 years. FoodRx is longer than that, but that's when I started taking over the program. So produce prescription, if you haven't heard of the concept, is a medical intervention that connects patients with diet-related health conditions to fresh fruits and vegetables. It's been in the US for decades. I think the most prevalent initiation of it was during the AIDS pandemic. There's a lot of other versions of what FoodRx looks like. So there's medically tailored meals, which are super specific. There's like funded CSA programs through hospitals. So a wide range of what is offered out in the world. During the pandemic, everything sort of ramped up. So people were isolated and they weren't getting the food they needed. And there was some pandemic EBT money and a lot of different factors just ramped up the idea in the US. So since then, there's been a lot of programs popping up all over the country, kind of like chasing that grant money that is happening. So with Land to Hand, we actually started our program pre-pandemic, but 2018, 2019, we partnered with what was then the Whitefish North Valley Hospital. Logan Health has now purchased the hospital systems in our area, but it was the North Valley Hospital Foundation that was the beginning of FoodRx. In that iteration, participants received vouchers to spend at the farmers market. So it was like a weekly little paper voucher that they would come and spend on fruits and vegetables. There were a few education opportunities that hospital put on. There's a plane tree learning garden at that hospital. So it was a nice little collective. That cohort was pretty small, maybe like 5 participants, and it was just the farmers market season. In 2020, Logan Health came in and there were a few grants associated with this, but they created a food pharmacy work group. So we expanded to a handful of different clinics. We still had that same program model of coming to the farmers market. And then in 2021, it became pretty clear that the pandemic wasn't going away and we needed to continue to help these folks outside of the market season. So we partnered with Western Montana Growers Co-op to create like a CSA style box that they would pick up weekly. And so then that created an annual calendar for this program. And then in 2022, the big boom for us happened. We got a large grant from No Kid Hungry, and it pushed us into our current version of what FoodRx is. So with that grant, we increased immensely. Our current enrollment is at 64 families, so 202 individuals. We do still have 9 clinic partners, 8 of which are Logan Health. 1 is the Greater Valley Health Center in Kalispell. Our farthest reaching is the Eureka Clinic in Lincoln County. And our most condensed population is in Columbia Falls. I'm hopeful that we will expand like towards Hungry Horse, towards Glacier Park, because that area is definitely more of a food desert than the Central Valley. So our program goals are to increase the consumption of fruits and vegetables, increase the comfort of cooking with fresh produce, and contribute to positive health outcomes for the whole family. So we do refer to one certain patient. Our clinic partners give us their patients at a single level, but we know that any sort of behavior change is a family change, and so we're trying to serve the whole family. And these are big, broad program goals, but I think what I like to refer back to them as pillars of the program, because we really aren't trying to solve like specific health outcomes. We just want people to know where their food comes from, and we want them to access it, and we want them to love it. I mean, my biggest thing is that I love to cook, and I love to have a meal that was fully grown from people that I know. And I think if everyone was able to do that, then a lot of things would change. So our participants are referred to us by our medical provider partners. They're screened on intake. Logan Health does this automatically, which is really wonderful. Using the hunger vital sign, which is this 3-question. Many of you may have answered this at like a clinic intake form, but it's I'm not even gonna be able to say them, but food insecurity questions of whether or not you have had enough food to eat in the last month, the last 12 months, whether or not you're skipping meals or taking smaller portions because you're sharing your food amongst your family, those types of questions. So all of our participants have screened positive for food insecurity. They also all have some sort of diet-related health condition. mostly diabetes or hypertension. Those pieces of it, I don't actually even know. I just rely on our medical partners to deal with that. As we know, fruits and vegetables are going to help everyone. We will all have better health outcomes if we eat more and have access to more. And then we, like I said earlier, we prefer to serve families. So they have a preference, but it's not necessary. Some of our clinics, like the Eureka Clinic, serves mostly an elderly population. So a lot of those households are 1 or 2 people, which is totally fine. Just great. So how the prescription works, they are in the program for about a year, and every week, that's not true, every other week, every 2 weeks, they receive, we refer to it as like CSA style bag, because people have that as a reference, but it's a bag of veggies that's a wide variety, hopefully, not getting a cabbage every week. We had a problem with that for a little while, and we had to mix that up. In that share, they receive a guide to what the veggie is, a photo of it, a description of best ways to use it, or in this case, my favorite ways to use it, because I make them, and best practices for storing it. So many of these folks that haven't had access to fresh produce in their life truly don't know what to do with it. And if you leave a head of lettuce out on the counter, it's gonna go bad and you are gonna miss out. So there's some really basic storage tips. Obviously, some of our folks have a lot of skills already, but there is definitely a lot of learning in this program. They also, so monthly, we had been putting out recipes every week, and we realized that just a recipe is not really serving folks super well. So we're trying to incorporate more of an education aspect. So I'm putting together these monthly booklets. I have a lot of these things if you guys want to come look at them. I didn't print many for the sake of the environment, but so the guides look similar to this. But we're coming out with these monthly little booklets that have recipes, some sort of skill, like a knife skill or some learning portion. We put community resources in there. So like in this February one, I think there's an invite to our Feed the Seeds event. So we're working on that as like an annual curriculum. And then on top of the education, we offer 4 seasonal meal kits. So quarterly, we come home with something more than just veggies. And I think we go through what those are. Well, so here's some examples of this middle piece. That's the bag of food that they would get. When they first enroll, we give them lemon juice and olive oil and a whole list of salad dressings that they can make with those ingredients. The Good and Cheap Cookbook, if anyone hasn't heard of that, please look it up. I think there's a link on our website. It's amazing. It's super simple recipes that are healthy, veggie forward, and have like simple ingredients. So you can use a small kitchen and basic staple ingredients from your cabinet. And then the produce guides look sort of like this. Our enrollment packet, I have examples of everything up here if you want to look at it more closely. But we hand out a little booklet when they first enroll, just to like talk about the program, answer questions, blah, blah, blah. So our meal kits, I like to try and have Montana commodities, like lentils is a big one. We do a chickpea one. So things that are not necessarily going to come in their produce share, but are still Montana grown. So this is our lentil taco, and we also do a lot of partnering with Harvest of the Month, both in our education programs and in our food access. They have such awesome resources and really great family friendly recipes. So those are our 4 meal kits right now. We have the lentil taco and coconut curry. The Three Sisters soup is a recipe from Mariah Gladstone. And she has a really awesome video instruction that I love to share with folks. And then we do a quinoa tabbouleh in the summer. So it's kind of a mix of like as you can see, the coconut curry one is all stuff you can just dump in a pot, and it's really easy. Kids can make it. Everything's good to go. And then things like quinoa tabbouleh, like those are just pantry staples to help them round out their kitchen. So we try and do a little mix of that. I think the most important part of our program is Brooke. I don't know if any of you know Brooke. She has a farm, Wicked Good, in Whitefish, and she and her husband and 2 other farmers in the area operate a small local grocery store. For a lot of reasons, Brooke has really just creates the most amazing produce shares. She is really well connected. So in the summer, honestly, even like this last November, everything in her share comes from the Flathead. Obviously, this time of year, she's reaching a little farther. And because we like to offer at least one fruit item in each share, we'll get oranges or something else that's seasonal. But I think what really stands out for our program is that we are making seasonal local food choices. A lot of programs are offering vouchers for the grocery store, which honestly is great. It's what a lot of people need, but our focus on local food is pretty exciting, I think. She also just is a lovely human, and she loves to do this and does such a good job of like considering what a meal might be, considering what the family might plan for the week. I wish I could just share with you all the produce guides because they're awesome. This is our little warehouse. So for the timeline of enrollment, folks are enrolled at the clinic, they have an initial survey, they get their produce share. There's a little enrollment package that I showed you with the cookbook and everything. About 6 months in, we do a midpoint survey. I am constantly communicating with everyone via text to remind them of their shares. So hopefully any problems that arise, we already know about. But the midpoint survey is really just like, how is this going for you? What can we do to help? Are you getting all the resources you need to utilize this service? And then the exit survey at 1 year is almost identical to the initial survey. And that's where we're trying to track the behavior change. So are you eating more veggies? Are you feeling more confident? That kind of thing. These are our clinic partners. And then in the summer, we opt for a choice model. So folks can continue to receive their shares, or they can shop at the farmer's market. I'm always shocked that more people don't choose the farmer's market. I think we had 10 families choose that option this year. I think partially farmer's markets are intimidating, and they also take up a lot of time. It's a lot easier to just grab your bag of veggies and call it good, knowing you have fresh local food. But I would love to try and incentivize this community-driven aspect of it a little more. The people that do come to the farmer's market love it, want to come back year after year, create really great relationships with their farmers. So that's the goal. Also, choice model in general is a goal we're working towards. Like I can wax eloquent about Brooke all day, but at the same time, if someone just doesn't like chard, it's gonna go in the trash. So choice model is always the direction we want to go. So does anyone have questions about like the program so far, specifics? If you do, I can talk about it all day. But our impact is really the whole point. So we know for a fact that everyone, pretty much everyone that has gone through the program for at least a year has had a great experience. They tell us this personally, but how we track that is a little more complicated. Our soft outcomes are the ones that come from those surveys, the conversations, participation quotes. But that's not necessarily what funders are looking for. So we have these spreadsheets of folks' health metrics throughout the program. We attempt to have at least the beginning 6 months and end. Many patients are in the clinic more often than that, so we get more. But some folks don't go to the doctor, so it's hard to really have, we aren't asking anyone to go to the clinic specifically for this program. So it's a wide range of what we have. I'm really excited because we have an AmeriCorps Vista that's a stats major. And I watched by his computer the other day and it's just like running programming. Looks like the Matrix. And then he came out with all these like exciting things about people dropping this many beats per minute in their heart rate over the year. So hopefully we'll have some cool data to share. But measuring outcomes, these came from those surveys that I was talking about. And I think they're actually pretty exciting. I would say that the number of surveys we have is not huge currently, so this isn't like an enormous population, but just the trend is really exciting to me. So the frequency of home cooked meals per week has gone up. As you can see. This one is like my favorite, is that participants' energy level within the year has gone up. The red is the core energy, and it's obviously shrunk so much, which is, I think, a huge deal. People are just feeling better, which is great. And then this is adding fresh produce into their diet. So where are we headed? The population we serve has a lot of barriers in their life, and it is always our goal to break those barriers down and meet participants where they're at. I think one of the biggest cofactors is transportation. We have expanded our home delivery route by a lot, so we drop food at the diabetes clinic, at the Flathead Food Bank during their open grocery hours, so that folks can choose to shop and pick up their share. We have a site in Columbia Falls, and we have a site in Eureka. And other than that, I think we have like 15 right now home deliveries. So we're trying to get people the food they need where they need it, rather than, I get a CSA in the summer, and I swear half the time I drive halfway home, I have to turn around, and this is my job, so I get it. It's hard to remember these types of things, and these folks just have really crazy lives, so as we all do. And then we're also trying to refine our education materials. So I'm trying to create a year-long curriculum. So when folks, they can enter throughout the year, obviously, but once they're in the program for a year, that means they have access to all of those nutrition education pieces. So our meal kits we're going to do a taste test next month, which will be the first one we've done, which is exciting. I would love to host some cooking classes in our area. We don't currently have a SNAP educator in the Flathead. That would be huge if anyone wants to get a job. It's open. And choice models. So those are all the things that I'm hoping for. Yeah. We are not alone in Montana. There are many programs across Montana. They're all pretty different, which is exciting. Farm Connect, used to be CFAC, hosts a grant for us and hosts a learning cohort. We actually had a summit in the fall called URS Summit, which is the first of hopefully many. So it was fun to just get like all the right people in the room talking about the same stuff. We do have learning calls together throughout the year on Zoom. But I just want to briefly go through all of it. Obviously, this is Western Montana, as you can tell. Hopefully, we'll get more in the East, but there are many that are not in the collaborative that are popping up. Like things are happening. If there might be some in your communities that you're like, I've heard of this, but they're not on this list. This was a slide from that summit. So there's more and more every month, it feels like, which is really awesome. Fast Blackfeet does an amazing job at their produce prescription program. They offer meat along with veggies, so they get vouchers for bison, which is pretty exciting. Their program coordinator is also a dietitian, so she is licensed to do nutrition counseling one-on-one with each of their participants. This Bar One Wellness is an interesting model because the woman who runs it has a private clinic. So she doesn't have to jump through all the like Logan Health hoops, all the big medicine hoops. She gets to kind of do what she wants, which is very cool. PHCs in Missoula, they help refugees resettle in the city. They do gift cards to Winco, and this works really well for them because Winco is the best option for folks that are eating diets that are not traditional American diets. I think their program is a little shorter because it's just during the amount of time that they're helping folks resettle. But they do a really amazing job. St. Pat's, I think, also does vouchers. But they also have a diabetes educator on staff, so they also have one-on-one nutrition counseling, which is exciting. St. Pete's in Helena is really similar to St. Pat's. Libby is the one that I always like to shout out because they are truly community driven. It was just one woman in Libby that heard of this concept and she made it happen. She like found all the right people. She got some money from MSU and she really made it happen for her community, which I think as we talk about Food RX as like a sustaining program and a sustaining medical intervention, I don't want to lose this type of thing. Like we all know our communities best and we know how they should be served, and I just love them. They're doing great. Rocky Boy is not actually part of the collaborative, but they are part of a grant called P4. So they got quite a bit of money for 5 years, I think. I just saw a presentation from them last week, and they are doing some really amazing things. It's more of like a holistic. They're also doing vouchers for meat. They do a lot of classes that people come. It seems like they have really great attendance, which is awesome. We have not had a huge amount of luck with attendance, so I would check them out. They have a website and they're just doing really amazing things. One of the things they do that I would love is helping people learn preservation techniques. So like they have a freeze dryer. I think they do some canning classes, just how to utilize fresh food all year round. It's pretty exciting. So that leads us into what is next and what else do we need to do. I think the biggest hurdle we're coming across is sustainable funding. There's a lot of grantors out there that are looking for specific health metric goals, so specific blood levels of certain things that if you have the right clinic partner, you can make that happen, but on like a larger scale, that's not really what we're trying to go for. I believe the most sustainable way is to have Medicaid reimbursement. There's a waiver, I think maybe 7 states have passed this waiver that Medicaid would pay directly for that food. We are maybe a couple years out from that, but I think one of the steps towards that goal would be to continue to have a strong collaborative across the state, knowing what strengths we have in each community, what each community needs. And we also need strong local food systems. We can't serve people local food if there isn't any. I think I'm so excited about this idea of a distribution co-op. I think that's like the biggest hurdle for us. If there were 100 brooks in Montana, we might be able to make this happen, but there aren't, so we need some trucks. So the questions that I think we're like almost at time, so I'm gonna leave you with these questions rather than discuss them. But things that we need to think about if we are going to work towards a Medicaid pathway would be, how do we define success? What metrics do we all need to be tracking? What questions should we be asking our participants in those surveys? And can we scale up and should we scale up? What is that sweet spot for each community? There are stories, especially in Washington, of these Medicaid reimbursements coming in, and all of these small, really amazing programs that were serving their communities well are taken away because they aren't the cheapest option. So they'll just end up having like an Instacart delivery to their participants, and that's not what we want. We want to bolster the community food systems that we have. We want to serve our clients the best way we know how. So that's where we're headed. And I think I'm over time already. So thank you.
I'm just really intrigued on your data collection and how you're getting medical data from the clinic.
Yes,
That's amazing.
it is. Yeah, we have
I think that just shouts out what amazing collaboration that I can't even get my husband.
I know. So we have an MOU with our clinic partners that sort of lays all of this out, but that is one of the roles when we create a new partnership with someone, is that they have to do that for us. A hurdle is that we use Google platform, like we aren't HIPAA anything. So we have all these crazy decoding of information and like encrypted emails coming my way that are gibberish if you don't know what you're looking at. And it is a headache for sure, but you're right. It does speak to how awesome our partnerships are.
I just want to give you guys a shout out how great it is. Like I was thinking about generational. You're doing it. Yay.
Yeah. Well, I mean, something I've been thinking about. Something I was thinking about when I saw that Rocky Boy presentation is that there's a lot of generational information that was lost in the last couple of generations. Hopefully,
I also want to say that it was Pam Gerby's initial idea. She was like, we should have vegetable prescriptions. And it stuck in my head and, we manifested it. She's usually the idea person.
Jody brought something up to me earlier that I guess Bob Quinn had said, that we used to pay, well, I'm not gonna say it right now. You should say it.
Okay, so we used to pay a lot for our food and not very much for medicine. And now we pay a lot for medicine and not very much for our food. And what would happen if we improved the quality of our food so that we could decrease the need for medicine?
I think that's all I've got. I'm obviously around all weekend, so I love to talk about it. There's also some like one pagers about FoodRx if anyone wants to grab one.
Yeah.
Stepped out too, so I think we have a break right now. And then if you look at the amended schedule, it looks like at 10:35 in the Meadowlark room, which is the other room, we'll be doing effective board members for the community. And here in the Bridget room, yeah. We didn't know where you were.
Jody's she got it covered. That's what it is. So, we're gonna do, a quick break till 10:40. We've got snacks, fruit, refreshments, coffee in the main middle room here. And then just what Jody said, Meadowlark for the leadership training with MSU, in here for ag finance, business planning with Ag West. So we'll see you in either room in about at 10:40.
Yeah. I really love that you put COVID to like a challenge. Yeah.
It's so impressive.
And then the microphone.
He's gonna stay.
But it should.
Yeah, he's got that, because that, I've only been one time, because he's so crazy, so.
Yeah, we'll get there once I.
Hi, all of us, years.
I think you've been on Zoom calls together, but I haven't.
Yeah.